Are you often feeling very tired, getting sick frequently, have some brain fog, or been told that you have thyroid issues like hypothyroidism? Well, did you know that low iron could be to blame? Welcome to the Wild Wisdom Show. I'm Dr. Patricia Mills, holistic medical doctor, transforming women's health with root cause natural solutions. And today we're going to be talking about the conundrum of iron and how, even with normal blood work, it could be showing up as a root cause of many of your symptoms. So, what is iron deficiency? Just as a basic starting point, iron deficiency is when your body is experiencing low stores in iron. And now, this could be so severe that it does show up on a blood work panel, but it could be more subtle to the point where your blood iron stores still show up as normal, but you have low iron stores in different tissues. Now, if you do have very low iron stores, you're going to probably be eventually diagnosed with what's called iron deficiency anemia, where you have low production of red blood cells. Red blood cells are what carry oxygen to tissues for energy production. And so when you have an anemia, you can get problems with low energy, shortness of breath. And this is especially common in women of childbearing age because of menstruation, blood loss. Kids can also experience it if they're not getting enough iron or absorption through their diets, as well as older adults for the same reason, but more in terms of a problem with absorption as we age, as well as changes in our dietary habits too. So this is a very well recognized issue, and medical doctors are very adept at identifying this on blood work. And you may be told to take a supplement or to change your food dietary patterns or both. However, it's important to understand that you can have problems with low iron even if you don't have anemia on blood work. And this could result in symptoms, as in your body's experiencing problems as a result of low iron with this normal blood work marker. One of the reasons for this is that low iron can impair mitochondrial function. So mitochondria are these little organisms inside of our cells that are responsible for making energy. So they're like the batteries inside of our cells. And when we're low in iron, our starts to work less optimally. And this could affect different tissues of the body in different ways. One key symptom of a general effect of this on the body is fatigue. So being tired, even though you feel like you might be getting enough sleep, and despite of that, you're just tired throughout the day. And so this is a very key symptoms, is fatigue that really just doesn't go away no matter what you do. I mean, if you're doing something you're really excited about, you might be able to generate some mental energy around that, but physically you're still going to be feeling tired. So this is one key symptom of low iron stores. Another experience that you may have with low iron is brain fog or problems with brain functioning and low mood. And this is because when we have low iron stores in the brain, it actually impairs brain function. Now, this could be what's called cognitive function, like how you think and how you memorize things, your short and long-term memory, and your ability to concentrate. But in some people, it can even affect movement. And in children who have iron deficiency, it can impact their ability to properly coordinate movement of their body through action of the brain. So that's a potential symptom of low iron. Low iron can also weaken your immune system. So your immune system, very responsible for defending you against infections, both viral and bacterial. If you find that you're getting frequent colds and infections, one of the core roots issues could be low iron. And so that could show up as frequent colds. Low iron also impacts hormone production, particularly in the thyroid. So the thyroid requires a certain amount of iron to make thyroid hormones. And when we don't have enough iron, some of the enzymes that make the hormones, which are kind of like little tools, protein tools in the thyroid, become less able to make those thyroid hormones. And so you can actually get a hypothyroid picture with low energy, problems with temperature control, cold hands, cold feet, hair falling off, weight gain, even though you're not doing anything differently, low mood, irritability, those sorts of things can show up due to a low thyroid issue that at its root is caused by a problem with low iron. Interestingly, low iron also affects our overall health by increasing our body's absorption of other heavy metals. So when the body's low on iron, it's going to try to grab iron-like substances from the environment, trying to compensate. but those other metals aren't as effective in our bodily functions as iron is. So that heavy metal absorption, that increase actually can impair body function. Now, what's interesting is that when we talk about low iron, sometimes people get stuck at the low iron part and all they do is they change their diet or they supplement. Now, that is an important piece, and I will be giving resources for this. But you need to understand is that when you have low iron, you also have to look at what are the root causes of that. And I have created a video, an episode on the Wild Wisdom Show, diving deep into the root causes of low iron and how to test for those and how to fix those. So you're definitely going to want to look at my low iron playlist, and I'll put that resource in the caption below the video. And I've also gone into what you can do in terms of food and supplements, because there are strategies that you can take with your food to improve the levels of iron and absorption of iron from your food. So even people eating meat, for example, which is a high source of iron, may experience low iron because they're not eating it in the right way with the right food combinations. Maybe it's a problem with digestive health, causing an inability to absorb that iron. Maybe you are a vegetarian or vegan and you need to learn the strategies to keep your iron levels high and absorption high in your diet. And did you know that when you supplement with iron, you can't supplement with it every day? That can actually decrease your iron absorption from your supplement. That plus other tips are in videos that are in my low iron playlist. I highly recommend diving into that, because what you're going to want to know is, number one, why do you have the low iron problem? Number two, are there other blood markers that you can look at other than iron stores that could indicate that you have problems with low iron? I'll be doing a video on that next week. And when that's ready, I'll put that in the low iron playlist as well. And what you can do in terms of your diet and supplements to mitigate this problem while you're dealing with the root causes. So be sure to explore my playlist on low iron. Your energy and well-being depend on it. And the takeaway is, listen to your body. Your body will always give you clues when something is not right. And it can be a bit of detective work to discover what are the root causes. It's rare that it's just one issue, like just low iron. For example, low iron can be caused with problems with your gut microbiome, with your low stomach acid levels, due to problems with nutrient deficiencies or too much stress. And again, all of these resources I have placed in the caption below the video, and you can go there and start educating yourself, empowering yourself so that you can solve this issue, get your energy back, and feel amazing. If you enjoyed this video, please subscribe, save, and share. Sharing is caring, and you never know when someone's going to benefit from this wild wisdom. Subscribing to my YouTube channel at Dr.Patricia Mills is the very best way to support this show, and I look forward to seeing you next time. Hope you have a wonderful rest of your day, evening, or night, depending on when you catch this. Bye now.